Just wait a few seconds till everyone can get in.
Mute herself. She's talking.
Good evening, everyone. Thank you so much for joining us on this very special presentation for SUDEP Action Day. We have some pretty amazing families joining us this evening, and our very own Bill Murphy. We're going to start with Lisa Maffie, who will introduce herself and tell us about her story. And then Kevin and Catherine Hooper will also speak about theirs. And then we will have Bill talk about the SUDEP awareness bill that we have and how people can help. And then we'll open up the floor for any questions, comments, discussions. We do usually end at 8 p.m., but if discussions are continuing and people want to stay, I will stay on, but please don't feel obligated to stay on if you have other things you need to do. And with that, I would like to introduce you to Dr. Lisa Maffie.
Hi, everybody. Good evening. I'm really honored to be here on this SUDEP Action Day. I'm always so happy to talk about Anthony, and so I'd love to introduce you to him. Let's see. Well,
This is tough.
maybe I am not going to introduce you to him. Oh. Bear with me for a moment. Okay. Can you see him?
Not yet. We're still just seeing your Zoom screen.
Oh, okay. Let me stop sharing this. And
This is
how about now?
there he
Okay.
is. Yes.
There he is. Awesome. Okay. So this was Anthony. This is a photo taken at a family wedding 3 months before he passed. He was 22 years old in this photo. As you can see, he was a junior at Curry College. Anthony was studying nursing. Such a beautiful smile. He was diagnosed with epilepsy at age 16. So he was diagnosed with tonic-clonic seizures. He had his first one at age 16 on the school bus. And then he went on to have 6 more. Some of them clustered together, like 2 or 3, all tonic-clonic. 2 of them were nighttime seizures. And then he went long periods of time where he did not have seizures. Before his 7th and final seizure, which was SUDEP, there was 2.5 years from his 6th seizure to this SUDEP one. On January 4th, 2019, he had just finished working evenings. He was a nursing assistant at Milton Hospital, and he loved what he did. They loved him there. He was born to be a nurse. He loved helping people. But he came home on that evening shift around midnight, spoke to his brother Austin about getting up to watch the Celtics game. They were going in. My husband and I always give them tickets during Christmas, and said goodnight. And when he didn't wake up at the agreed upon time, Austin, who was 19 at the time, went in and turned the light on and immediately knew that he was gone. So Anthony was treated at both Children's and Mass General Hospital by epileptologists. And we were never told about SUDEP. We were given lots of information about seizure prevention throughout the years, medication adherence, stress reduction, easy if they're drinking alcohol, but nothing very specific, and also nothing that was revisited on an annual visit. And as we know, there are risk factors for SUDEP, such as alcohol use, medication non-adherence, the fact that a person has generalized tonic-clonic seizures puts them at 15 times the risk of dying from SUDEP. We know that people who sleep alone in a room are much more at risk for SUDEP. The stress and the use of the alcohol or other substance abuse that we spoke about. Pairing the word epilepsy and the possibility of dying from this entity called SUDEP is so important because it raises possibly the motivation in trying to keep seizures under better control. And that discussion should happen between a neurologist and a patient, a neurologist and the family member. But one of my biggest advocacies over the years, one of the reasons I went back for my doctorate, I'm a nurse practitioner, I had my master's, I went back for my doctorate, was to talk about how to raise the discussion of SUDEP communication. And over the years, I've really sort of expanded my advocacy that SUDEP discussion doesn't just belong within the epileptology, neurology realm, right? I wish my pediatrician had known about sudden unexpected death and epilepsy because Anthony certainly saw him more than he saw his neurologist. And I wish, the nurses in the pediatric office knew about this as well. I think the bigger we can make SUDEP discussion, the more public we can make the entity of SUDEP, the more we can see the word SUDEP under the diagnosis of epilepsy, the more it brings a global awareness. So there are certain risk factors, right? And I think that's one of the biggest challenges here is for patients to ask their neurologist, their epileptologist, what is my individual SUDEP risks? And that places the autonomy and the empowerment within the family so that we know, well, you have tonic-clonic seizures already. You're at higher risk. They happen at nighttime. So what can we do about nocturnal monitoring? What can we do about perhaps, having you share a room, particularly at high stress times when there's sleep deprivation or when we know that, our 22-year-old had been drinking. In Anthony's case, he had come off of a New Year's Eve weekend. He was partying with friends at 22 years old. I'm sure there was alcohol use. That alcohol use can make him forget medications, can lower seizure threshold, can interfere with medication absorption. He was somewhat sleep deprived. He went right back to his evening shift for 2 nights in a row. And then that third night when he went to sleep, he never woke up. But had someone systematically talked with Anthony and us about the SUDEP risk, this would have been front and center in both of our minds. We would have been able to have a very transparent conversation about it. Anthony was not a real risk taker. He was pretty methodical, especially about his epilepsy. He told people that he worked with, once he got, the interview, he said, I have epilepsy. It's fairly well controlled, but I need you to know what to do if this happens. And one of the person that interviewed him at BI Milton said, you're in a fabulous spot to have a seizure. So thank you for sharing that with us. So they really helped to make Anthony feel comfortable. And I think he would have taken his risks to heart and tried to mitigate them when he could. So again, we are looking at better detection devices for SUDEP, not just ones that can detect a seizure, but devices that can detect changes in heart rate, changes in breathing, changes in skin temperature. But we first need to be talking to our caregivers about individual risk for SUDEP so that we can start to explore if we need better seizure control with anti-seizure medications or surgery or any of the neuromodulators like the RNS or the VNS, any way to get better seizure control. I won't steal Bill's thunder about that. I did just want to mention briefly, not to get too much into medicine or the genetics, but I do feel like in the past 2 decades, in the year 2000, SUDEP was really not even talked about, known about. Here we are in 2025, and Cure Epilepsy has sponsored a common data element and case report form from preclinical research trials. So these are animal models. So it's they're developing forms that are sort of like a blueprint so that all of the researchers who are doing preclinical studies are speaking the same language so that that data is able to be uniform and translated uniformly across different entities. And then defining more the effects of the neurotransmitters. We know serotonin can sometimes interfere with the breathing patterns in a person with epilepsy. Genetic testing, redefining how those genetics overlap with cardiac arrhythmias and how that affects SUDEP risk. And again, development of those better predictive tools. So I feel like for me, having been unfortunately thrown into the entity of SUDEP, I do feel like we're starting to move the needle. I just wanted to talk a little bit about advocacy, not only for Epilepsy Foundation of New England, but for Cure Epilepsy. So I just came off of the Chicago Marathon. My best friend's daughter here, Michaela, on your left, ran in honor of Anthony. This family is like cousins to us. And Michaela was sponsored by Cure. Anthony's motto on his Instagram page was expect nothing and appreciate everything. So we had a sign made as we cheered her on. And then our t-shirts show that beautiful picture of Anthony that I shared in the beginning at the Chicago Marathon. And on the back, it says, Cure Epilepsy and End SUDEP, which is really my mission and drive, and I know all of yours. We can go back to the resources at the end, but I just wanted to share that there are so many resources available on sudden unexpected death and epilepsy and support there.
Thank you, Lisa. Those resources will be great. So we'll pull that slide up again at the end.
Absolutely.
Next, we'd like to introduce Catherine and Kevin Hooper, and I believe Kevin is going to speak about his son, their son.
I'm going to put his face in front of the screen.
She's gonna let me talk for as long as I want. So let's hold this. Kathy and I have 3 children. We adopted all 3 from Korea, 3 to 5 years apart. Carson, our youngest, died from SUDEP 8 years ago at age 25. He arrived we were living in Northern Virginia at the time. He arrived at Washington National Airport on this day, 33 years ago, 7 o'clock-ish. It was their early evening. So this is our, we would celebrate with the kids their arrival days. Cake, present, another excuse for cakes and presents, so we have birthdays and arrival days every year. And tonight we're going to talk with the kids, other 2 kids, about Carson and, tell stories and stuff later on this evening. He had his first seizure at age 10. Prior to that, I don't know how to describe him other than wild. Running away from us, screaming, laughing, running into the street. His social security number was 007 something, so we knew, we were in trouble. When the seizures, and I don't know if it was seizures or the medications, probably both, it changed him. He was much more circumspect or something. Subdued, yeah. We tried at the age of 10, we tried all sorts of combinations of meds, many of which are now old, and now there's many new ones. Through middle school and high school. In high school, we started preparing for the potential for him for some surgery where they were going to remove the portion of the brain at Boston Children's, portion of the brain where the seizures were initiated. Went through years of tests. We participated in a number of research projects, and I don't remember which university it was now, but he was really into it. After he had graduated from high school, we went to had surgery. The seizures went away for 3 or 4 months. We're not sure exactly what. And then they roared back. And I'll say that was the second worst day of our lives. That morning or that evening when the seizures came back, like it was a fail, and we're all crying about it, but nothing like with him passing away. Um, uh, and then it was kind of the same pattern they had before. I guess I didn't mention what the pattern was before. He'd have clusters of 3 or 4 seizures over a 2 or 3 day period, usually in the evening, but sometimes during the middle of the day, kind of monthly. And Kathy's going to hate me. Don't tell her not to listen. Which I even tracked it. I'm an engineer, so I tracked it. I checked it against her menstrual cycle to see if that had anything to do with it, and it didn't. Thank God. But we had no idea, and the doctors didn't either, as to why it was happening kind of monthly, every 4 to 6 weeks. But that was kind of it, and we tolerated it. He didn't like it, but as he said, the only thing he didn't like about seizures was the headaches afterwards. He didn't know what was going on during the seizure. So the day he died at home in his bedroom. Found him early in the morning. Found him in the morning. I want to go to the details, but he was still warm. We tried CPR. The EMTs were there in minutes. Maybe 5 minutes at most. And they tried to revive him, but they were unable to. And that was that day. That was the worst day. The police person responsible for filling out the report as to what the cause of death was, when we told him it was SUDEP, he didn't know what it was. And he wasn't resistant, but he called the supervisor, called somebody, talked to the EMTs. I don't know who else he spoke with, but eventually he settled on that's what it was. And that's what we actually have on the death certificate, which we were pleased, that's the wrong word, but we were content that that was what they were put on there. As an aside, when Carson's pediatrician, he was now 25 years old, so he'd left his pediatrician, but his pediatrician, when he found out that Carson passed, called to offer his condolences days or weeks, I forget how soon, but soon afterwards. He was not aware of the term SUDEP either. And he was, our favorite pediatrician, two older.
I'm just going to interrupt. He was probably the most well-known, well-respected pediatrician in Greater Portland. And he had no idea when I spoke to him what SUDEP was, and neither did any of the emergency personnel.
Yep.
And it was clear to us, the position that Carson was in, that he had had a major seizure. There was no question.
Yep. And this wasn't the first time that we would generally hear the seizure, and his bedroom was next to ours. And we would, I guess I just did not mention, we live in Portland, Maine, outside Portland, Maine. So we're a couple hours from Boston. So our trips to Boston for these procedures and tests and stuff took up a lot of our time, took up a lot of his time. Anyway, but our medical community is top notch. And as she said, the EMTs, which I don't know that they should have known. Our pediatrician, we were amazed that he had not even heard the term. His neurologist or epileptologist, whatever she is, of course, did and talked to us about it at times. So as for coping, we immediately got counseling. And I don't know where everybody's is, if you're a SUDEP parent or a SUDEP sibling, or how you all stand. But immediately, any memory, his shoes, his jacket. Actually, we still have his jacket in the hall closet. What made us uncontrollably sad. But with time, and it's taken years. We could cry right now if you wanted us to. It'd be easy to pull up a picture, and the sadness is right under the surface. But with time, we've been able to his memories are happy things. You know, you memorize it, you remember the good things. We participate in the EF&E walks now. We did not participate in the EF&E anything prior to his passing. We participate in his walks and his name with fundraisers. His friends participate in these as well. He was big into robotics when he was in school. So he created, when he was actually in middle school, a first Lego League. If that means anything to you guys. It's a robotics competition that uses Legos and programming and stuff like that. He started that when he was in middle school, and then in high school he was the coach mentor of the middle school team, and so the team is named in his honor now, you know, since he passed. He was big. One of his passions, I guess, was Magic the Gathering, playing cards. In fact, there was one of the doctors at one of the, I don't know if he was a researcher doing epilepsy research at Children's Hospital, was a Magic fiend as well. So that really helped his stay there. He was there for 2-3 weeks. But the game store honored him as well. This summer, I participated in a state of Maine public hearing on an act to require epilepsy awareness training in all public or private, I'm not sure, all schools in the state of Maine. The bill passed. Carson had received, you know, I wasn't there to complain. If anything, I was saying that Carson had received excellent attention and awareness and support by the nurses and teachers at our high school, or middle school and high school. They had some training, but it demonstrated the benefit of having that sort of program or requirement in place. We're a little bit, again, I don't know where everybody stands, and when we talk in a few minutes, we can talk more about this. I don't know where you stand. It's weird isn't the right word. Uncomfortable sort of is the right word, being a SUDEP parent when we participate in the EF&E activities. Yeah, I'll say that in particular. As an example, we just had a October picnic here in the greater Portland area, and we had, I don't know, 30 or so people, some new families, new people we had not seen before. And one of the young men, let's say 23, 25, we welcomed him to a function that they'd never been to before. And he was a nice young man, asked bluntly, which one of you, is the patient here? And we told him the story. And see, I'm a second away from crying now. But thinking because then I'm thinking about Carson again. He comforted us, and we're telling him about SUDEP, and and he did not know the term, and he was had seizures. He was new, I'd say in the last 2-3 years, maybe he had started having seizures, then was driving and then had an accident when he had a seizure. So he was new to the program, wrong word, but new. His parents were there, and this is where I feel weird as a SUDEP parent. I don't want to scare him.
Yeah.
I want to make him aware. And he asked questions like, well, how does a seizure turn into SUDEP? And I don't know. Call Lisa. I don't know. At this point. And but he knew his neurologist, and they're well-known people and everything. And I don't know if he hadn't heard it, or if he was so new that they weren't going to introduce the term to him. And again, this is for everybody. I don't want to scare, have somebody live their life. This is going to sound terrible, but it's the Grim Reaper's hanging around your corner.
Yes.
You do that when you turn 70, then you worry about it.
Thanks.
Anyway, that's something, I think that would be something worth talking about, as we try and advocate some of these things. Last points. I didn't want to spend the whole time talking negative or sad stuff. So I hated to define Carson only by his epilepsy. So he had a very loud, contagious laugh, bear hugs would take your breath away. As I said, Magic the Gathering was his life. He wore irreverent T-shirts, many of which, so we made a quilt out of it, out of some of them. They're not for public consumption, many of them, you know. One of which it was a T-shirt that my mother, his grandmother, gave him, had WTF on it. It had to do with the days of the week.
Wednesday, Thursday,
Yeah,
Friday.
I know, but that's what she thought it was, but it was something else. And the kids got such a kick out of that, man. Like,
Yeah.
don't tell Grammy, don't tell him. He worked at the Hannaford Meat Department because he loved the cold. He loved the cold lockers. You know, we'd go in and he'd be the one to get the food out. He also loved cleaning glass, which they do a lot of that. So he was, you know, two other things. Now he asked the surgeon at Children's if he could have a piece of his brain put in a jar, put in his room, put in formaldehyde or whatever. It's like from science class. And that he's a famous doctor. I mean, he looked at him like he was from Mars. Like, no, no, no. And Carson just, you know, I thought I'd ask. Last thing, when he got so he didn't have a driver's license, so he got a state ID, of course. He got his state ID, and we're on a trip, and he says to the TSA agent, this looks like it's fake, doesn't it? Because they do sort of look like fake. And that's like the last thing you say to a TSA agent, you know. But that was his life. You know, I'm sure we have lots of stories about Anthony. Same thing, like, don't cry. You were so happy. To have those 25 years, minus one day, not that last day. But otherwise, and I'm sure everybody here on I'm thinking of your sign, Lisa, whatever that was, expect nothing, appreciate everything, something like that. And that's it. So anyway, I'm done. I appreciate it.
Thank you, Kevin, for being open and vulnerable and sharing so much about Carson. We really appreciate that. And thank you for everyone who's posting little emojis and comments and sharing your support. It's much appreciated. Bill, would you like to talk about the SUDEP awareness bill?
Sure. Thank you. Thanks, Lisa, Kevin, Catherine, for, on this most appropriate day, SUDEP Awareness Day, to share your stories. Obviously, we know you lost loved ones to SUDEP, but your willingness to share helped us sort of even to know them as people. So again, thank you for sharing that. SUDEP Awareness Bill, the reason is in hoping of making a difference. We filed what we call our SUDEP Awareness Bill in Massachusetts. And I know talking about legislation can sound wonky and whatever, but putting your stories out there like this and sharing your loved ones with us, and more importantly with legislators, they need to understand this issue, makes all the difference in the world. So a little background, we filed what we call our SUDEP Awareness Bill. Technically, it's called an act relative to education and prevention of sudden unexplained death in epilepsy and other related epilepsy mortalities, such as from swimming, accidents, drowning. So I told you it sounded wonky, so that's the wonky name of the bill, but we refer to it as our SUDEP Awareness Bill. Representative Joan Machino down near the Cape, she was the main sponsor of this bill, and she became aware of the need of the bill because of an epilepsy advocate, someone who's impacted by epilepsy, educated her about this, and she very willingly signed on. And in short time, because of our epilepsy advocates, who we call our epilepsy envoys, 12 bipartisan Republicans and Democrats signed on to the bill. So the bill was written up, introduced. like any bill, it's signed to a committee. In this case, it went to the Public Health Committee back, I believe it was in March. And then finally, that committee had a hearing on June 25th at the State House. And at that meeting, Lisa was there. We had two panels, actually. I introduced sort of the purpose of the bill, the language of the bill, but the heart of the matter was really our two panels that took their time to come to the State House and share their story. Lisa, obviously a mom who lost Anthony to SUDEP. She's, I hope I get this right, doctorally prepared nurse practitioner, which is puts her in a unique position to speak to both non-medical as well as clinicians about SUDEP. She was joined by Dr. Richard Goldstein, head of a program at Children's Hospital. Dr. Goldstein and Dr. Latzer and Dr. Pearl, all from Children's Hospital, they conduct specific research on SUDEP, and they shared not only their findings, but their personal findings from this research. And one thing stuck with me that, anybody losing somebody goes through grief, but losing a child to SUDEP, they're finding the parents, the families go through a unique grief, a different kind of grief. And those findings and those stories is what hopefully will move this bill forward. And joining also Lisa and the doctors were Libby and Mark Ferenzi, parents who lost their son MJ to SUDEP. So that's it in a nutshell. Right now, because the legislative process, we're in our waiting period. The hearing was in June. They have until next week, October 21st, to report this bill out, meaning that it has to get out of the Public Health Committee to go to the floor. If it doesn't get out of the Public Health Committee, it doesn't move forward, and we would have to refile the bill. So we're keeping our fingers crossed, but more than keeping our fingers crossed and hoping, our advocates have tirelessly been in touch with the members of the Public Health Committee, urging them to, again, support this bill. So, as I said, we're waiting. We'll keep people posted, but now our effort is on keeping communication with these committee members to urge them to move the bill out. So, what does the bill do? It would require the Massachusetts Department of Public Health to develop and disseminate informational resources and conduct a statewide campaign to increase epilepsy awareness on SUDEP and other epilepsy-related mortalities. They would have to develop and disseminate this information statewide, geared towards healthcare providers. So often we heard our docs never mentioned this to us. We never heard of SUDEP. So we want to get that information out to healthcare providers, not just epileptologists and neurologists, but clinicians across the board, but also to epilepsy patients, how to bring this discussion up with your doctor if your doctor's not bringing it up with you, and families. We'll work with the Department of Public Health on what kinds of educational materials are available, where there's a void, hopefully help them develop new ones where new information is needed. As I said, it would be available to distribute to patients, families, clinicians, statewide, and also be included on the Department of Public Health's website. Another requirement, part of the bill, it would state that Department of Public Health has to submit a report, including metrics. What are the numbers? How many people did we reach? What kind of impact did it make? And then, I look at this as really a first step. But to really find a way to prevent SUDEP, we need data. And, Kevin brought it up. Most medical examiners, coroners are not aware of SUDEP, do not list SUDEP as a cause of death. But that needs to change. And so hopefully if this legislation passes, we can then move forward to attack sort of the lack of data situation, so that SUDEP is put on death certificates. You can then have hard data and numbers and hopefully move forward with that kind of data to find ways to prevent SUDEP from happening in the beginning. The other educational materials will also, in addition to awareness, will be promoting information on how to minimize the risk of SUDEP. Now, right now, we don't know for certain what causes SUDEP, but we know steps people can take, adherence to medications, et cetera, to help minimize the risk. So we're keeping our fingers crossed. Keep your fingers crossed for us that this bill gets out of committee next week. And it would be just a first step to sort of go after SUDEP from a public policy, and never feel that anyone's voice is too small in this movement. So what really has moved this forward are our advocates. So Lisa, the Forensics, and countless other families who have come forward to make a difference. So I'm happy to answer any questions about it. You know, we are having discussion, as you know, Epilepsy Foundation New England covers 5 states, and we're looking at hopefully filing these bills in other states moving forward, along with other legislation on other epilepsy-related topics. So I'm happy to answer any questions. Turn it over to Amy for any discussion. Or if people want to simply weigh in. So,
Thank you,
Amy?
Bill. Thank you, Bill, very much. I did put a link to our Envoy program if you're interested in having your voice heard and supporting all of the great advocacy efforts that Bill and his team do. That link is on there. I also shared your email, Bill, if people wanted to reach out to you directly. I do see we do have Libby Forensi here tonight. Libby, don't want to put you on the spot, but if you want to say a couple words about the work you did with Bill, or share your own story if you'd like, we welcome you to do that at this time.
Sure. Yeah, so our son, and Mark is here, but he's off camera, conveniently. Our son MJ, he passed away in 2009. He was just 10. He was almost 11, which is, you know, you'll find what I'm hearing is with SUDEP, you know, there's all this standard, they have this, well, they typically within all these ranges, but nobody ever falls within the typical of any of it, right? So, so yes, he was quite young. It was, you know, young for SUDEP, but yeah, he had epilepsy from the time he was 7 months old. He had hundreds and hundreds of seizures. And we tried every drug there was. He was on, I don't know, 10 or 11 drugs. He was on ketogenic diet, a low glycemic diet. You know, we tried everything, and, you know, he would have marginal success, and then it, you know, it was never very good. He never had control. So I personally had heard of SUDEP, but I had never spoken to a doctor. I had read about it in a book. My husband he wasn't aware that, he wasn't aware of SUDEP, and we had never discussed it with a physician of any kind. So, yeah, I mean, it's come a long way. Things have come a long way since 2009, where there's a lot more wearables. There's a lot better ways of monitoring. All I had was a baby monitor, and you know, it went off most times, but it didn't go off that night. So yeah, I mean, besides, and his grandfather is here as well. Angelo's on here. Grandpa Angelo is also on the call. And I mean, yeah, so he was an amazing, amazing kid. And while we only had him for 10 years and 11 months, he still to this day is makes incredible impact on the world. So the ripples in the pond is still going out and touching people's lives and hearts, even to this day. So still very, very blessed to have been his parent, and yeah, really want to try to make SUDEP more people aware of SUDEP. And if we don't have the data, again, what Bill was saying is if you don't collect, I'm a data person. And so without the data, we can't really, we can't figure out how to make it stop. So I think the bill will help us go a long ways towards trying to figure this out. Do you want to add anything? Okay.
Thank you, Libby, very much. I didn't mean to put you on the spot, but I
It's
was
fine.
doing a search. I did see other members.
I mean, I'm always happy to talk about MJ.
Thank you. At this time, Lisa, did you have anything else you wanted to add?
I maybe would just say that the work that parents do to be able to move forward is never linear. But when I saw Libby, and I know Mark is behind her, it was so lovely to meet them for the first time and to hear about MJ. This was over the summer. And again, Kathy and Kevin, we were early on. Carson shares the exact same birthday as Anthony, just born in a different year. So June 2nd. So I think that we've all done a lot of work to be able to be here and to be able to honor and advocate for our children so that no other family, hopefully someday, has to experience this. Yeah.
Thank you, Lisa. I also added, we record all our webinars where the presenters agree with that. As you logged on tonight, you saw that this one was being recorded as well. And we put them on a YouTube channel. So I added the link to that. And we do have, I believe, 2 webinars we did last year on SUDEP and why they think maybe it happens. There's no definitive answer, but we do have Dr. Lee spoke on one, and at the top of my head, I can't remember who the other doctor was. And just like Lisa put in the chat, they suggest, some stimulation, some agitation. But again, I'm not a doctor, so I'm not comfortable on speaking on that. But we do have that webinar on there. If you just go to the channel and you put in the search bar SUDEP, you'll be able to find those recordings. We have about 15 minutes left. If there's anyone else on here that would like to comment, share a story, have a question.
Say something. Can you hear
Yes,
me?
John. Yes, we can hear you.
I'm John Hughes. I'm calling from Colorado, but I'm from Massachusetts, and that's where my brother lived. And he died of SUDEP at 57 in 2007. It seems that many of the victims of SUDEP are younger than that. But he had epilepsy because of having meningitis at about 3. And I think he started having seizures maybe a couple of years after that. This was a time when this kind of malady, whatever condition, was not talked about. People tended to be like alcoholism or whatever. It was more hidden at that time. And my brother, I guess one of the things that he faced a lot, and he had partials, all right, with some tonic colonic in there. But, they seem, as I understand it, they're the hardest to control with medication. with medication. Anyways, the point I think that's most important to me to make here is that he socially isolated himself. And part of it had to do with good-meaning people who didn't really know about what to do if someone has a seizure. And they're calling the ambulance. It's a big deal. He's going to the hospital, this and that and the other thing. And it became very kind of embarrassing to him. He would maybe be down learning about how to use the computer, have a seizure, and this sort of thing would happen, and he wouldn't want to go back there. And I tried to explain at a college where I was teaching, and we had someone who had absence seizures, which are, many people don't know it's even happening, but they had this procedure. Now, everybody leave the room except the teacher and call the, this, and which was exactly not the thing to do. In the case of my brother, and I'm trying to make this as simple as whatever, is that if his seizure, goes past 5 minutes, yes, someone should call. But otherwise, if people understand that you just kind of, get a person in a comfortable position and just wait it out, they'll be okay. And my brother's activity was sort of like someone who was a little bit drunk, all right? And so that sort of social difficulty, the feeling of embarrassment, and then ultimately my brother had no friends, and that's the toughest thing I can say about him. That really cuts to the thing that bothers me so much. And there were other factors in our family, but this idea of the social reaction to epilepsy and how we might, through education or through some degree of technical things that are telling people, hi, I'm having a seizure. Please do not call, and that repeats it, anything like that. Any way we can get people to deal with it in an appropriate manner. Thank you.
Right. John, I think,
Thank you.
you bring up something that is just ongoing challenges, the stigmas oftentimes surrounding epilepsy and the social isolation. I mean, wouldn't it be great if we didn't even need an epilepsy foundation?
Yeah.
But we do. And, not only do we want to increase awareness and education, but for people living with epilepsy, part of our mission is to create opportunities to learn more about their epilepsy, to better control their epilepsy, have access to the services, but also for participation. We don't want them to be bystanders. So we hopefully are adding more and more opportunities for people with epilepsy to participate. I know Amy and her colleague Kristen do a lot of education, but no matter what we do, it's not enough because the challenges are so great. But we'll keep plugging away at it. And out in Colorado, you mentioned that you're in Colorado. There is a strong Epilepsy Foundation affiliate out there.
Yes.
I would encourage you to be in touch with them, find out what their programs are. I know affiliates across the country, including ours, are always looking for ways to include people with epilepsy in our programs so that they participate in the programs and help direct what we're doing. So I just wanted to throw that out there, Amy. Sorry to butt in.
Thank you, Bill.
Hello, I don't mean to interrupt. My name is Stephen Edwards. I run an epilepsy support group called Epilepsy Enlightenment. I'm
Yes.
also a member of EFA. I'm in Indiana. I have grand mal seizures. I have had grand mal seizures since 1989. I've never been a year seizure free, but I live and take care of myself.
I'm glad
Thanks
to
for
hear.
sharing that, Stephen.
I just
Those are
want to,
just the
Hello.
kinds of things we want to share with everyone. Thank you.
Thank you,
Yeah.
Stephen. Tiffany, sorry, saw you had your hand up, and then Orlando, we will go to you next. Tiffany, please.
Oh, thank you so much. So today I'm from Texas, Houston, Texas. And today we were able with, Mayor John Whitmire here in Houston, and our local congressman able to have Ja'Cory Thomas SUDEP Awareness Day here in Houston. That my son, who passed away 10 days before his 28th birthday. We had never heard of SUDEP. He was diagnosed with epilepsy at 14. Of course, we think that it started earlier because we didn't know a lot of the symptoms that we were seeing were results of seizure. But the last 6 months before he passed, his seizures were, progressively worse. He only had them at night when he slept, and we did go to his doctor and tell her that they were getting worse, and we wanted to know what do we do? Why is it getting worse? And he's been on medication since 14, and the only thing that we got is he has epilepsy. It'll never get better. It'll only get worse. Which is, I feel like that was a great time for her to educate us on SUDEP. Once after my son passed away and we called and told her, the first thing she said is, oh, he probably died of SUDEP. So she knew about it. She just never told us anything about it. And of course, with the research afterwards, he was a classic case. Everything that they said to watch out for, to look for, he had. So all of the signs were there. And so we're just, as a parent, as a mom and a caregiver, I started a group called The Devoted Mama. And it's just for, caregivers, a podcast that I've just slowly done soft launches to because it's still painful. My son just died over a year ago. So just talking in it, but really putting efforts to be there for caregivers. And like I forget, someone just mentioned that the type of grief that someone goes through when their child has died of SUDEP is different. And it's different because as a caregiver, we think that we've done everything we can for our child or our loved one, only to find out upon their death we were ill prepared, that we didn't do everything just because we didn't know. And so that opens up a whole nother part of grief. And so that's what my Devoted Mama is for. Please follow us on YouTube. And I have a book coming out in the spring. But thank you so much for having this today. It's so great to be around I don't want to say like-minded individuals, but individuals who understand your pain and what you're going through. We celebrated with Epilepsy Foundation here in Houston. They read the proclamation for us, and we had light refreshments there at their facility today on behalf of my son. So thank you so much for putting this on.
Very good.
Thank you, Tiffany. And I would encourage you and Stephen to put your the links for us to follow.
Okay.
Follow your websites, podcasts, all the things you have in the chat, because again, this is recorded and I will be sending the recording to everyone this week.
Okay.
So you can go back and you can see everything in the chat. Orlando.
Hi, this is my husband, Orlando. I'm Mrs. Torres. And
hello, Mrs. Torres.
We are so thankful to be able to be here this evening and to hear the stories, and our blessings go out to all of you. I had a question in regards for my husband, well, not a question, but just being able to talk about SUDEP. And again, yes, my husband has had epilepsy since he was 16. And recently we were finding out something, but we were never told, about SUDEP and stuff like that. I happened to read up on it and get a lot of information. So what's been going on with my husband was in regards to his heart. His heart has been pausing for like 20-second pauses when he has a seizure. And so I had questioned in regards to SUDEP because of the fact that there's no real, this is why it happens, but there is some starting to come out with some information in regards to the heart and having SUDEP. So anyways, just trying to find out more about this is very, very hard to do because again, the clinicians, the doc, they don't have, yes, this is it. You know what I mean? But so anyways, they wanted to do a pacemaker on him. But we also, as I was reading, could be a correlation between him having his seizures that basically stop his heart for his brain, the oxygen to his brain to stop, therefore stops his seizure. But trying to get more information as to if this is the cause or if this could lead to SUDEP, you know what I mean? We don't have that answer. So we're glad that more information is becoming available. Because there is some correlation that they're starting to find out about SUDEP in the heart, you know, basically having a heart arrhythmia or something like that. But in my husband's case, it's his heart stops, and generally 6 seconds is enough, you know, for a pause of a heart, but his can go to 15 to 20 seconds. And then reading the fact again that it could be, in other words, we just found this out because he did an EMU, 10-day stay in the hospital, and it was caught on recording. Other than that, we never knew about it. But then we believe that this may have been happening since he's had seizures, that he's had a heart pause and, you know, like that. But where he's getting older, we have the concern, 57 now, getting older, we have the concern that of SUDEP, you know, is more of a thing for us. But we're just thankful to be able to talk with, you know, people here. And, you know, so that's where we're at right now. So we're just thankful.
Thank you very much, Mrs. Torres and Orlando.
Orlando, say hi.
Hey, Orlando. Can I ask a question?
Please do.
For the people that have the seizures, with the medications, because I know, I hate to say it, I felt like a lab rat my whole life. Because they put you and want you to try so many medications, and they come with so many side effects. I mean, right. It's just, and it's like you try to read up on the side effects, and I mean, you don't even have that much time to read up on side effect after side effect. This causes this. Is there any specific side effects that, like, go against the SUDEP that's like speeds it up? Because, like I say, it's a lot of medicines that they prescribe.
Unfortunately, I don't know about Lisa, but I cannot give any medical advice. I am not a doctor, but I did post in the chat before you were able to join us that we do have a YouTube channel, and we have done 2 webinars on SUDEP by doctors who give a lot more information about SUDEP, why they think it happens, ways you can try to prevent it, different strategies, different epilepsy devices. So I would refer you to that YouTube channel. And again, in the search bar, just put in SUDEP and those webinars will come up. Kia had a question and she wasn't able to raise her hand. So Kia, you can unmute yourself, and then Kayleen will be our final comment of the evening.
Hi there. Good afternoon, everyone. My name is Kia. I'm sorry, please bear with me. I am located in Florida, and I do apologize. I would like to show my face, but I am currently recovering from a seizure. My lip is completely out of shape right now. But you guys, I do have epilepsy. I was diagnosed at 7 years old. Well, I'm sorry, I wasn't diagnosed. I started having seizures at 7 years old. And my diagnosis is sunflower syndrome, which is a rare form of epilepsy. I am attracted to light. I am unable to stay outdoors or go to the beach or functions with flashing lights or any bright lights, it will affect me after a certain period of time. I do seize daily. I have all of the seizures across the board. Absent seizures. I was initially diagnosed with grand mal seizures, but that went to tonic-clonic, absent seizures. Then they just finally diagnosed me with generalized epilepsy as well as sunflower syndrome. And with sunflower syndrome, again, that is a rare form of epilepsy. The percentage is pretty high with females. Females are more than likely to get that at a young age. And as just speaking for myself, and I'm sorry, with sunflower syndrome, I'm attracted to the light. So the sun, we wave our hand. So sunflower syndrome patients, we wave our hand at any form of light. It can be the sun, it can be the light in your home. I'm attracted to it, and I wave my hand in front of it, and that's where it triggers my seizure. I am now 28 years old. As of October the 7th, I am very grateful to be here another year. But it does worsen. And my condolences to everyone here who's dealing with that personally, as well as having any family members who's dealing with that. It's a struggle. It's a daily struggle. And I'm sorry, guys. I do seize daily. As I mentioned, I have all of the seizures across the board. So it's a bit of a struggle for me on a daily. I cannot say I am okay, but I will be okay. It's a mental thing. It drains you physically after a seizure. I just feel like it has been proven, and I actually, I do not qualify for any surgery. I do not qualify for any research studies, and that's actually how I came upon SUDEP. I actually I'm in Florida, but UF Health Neurology. I seen a specialist there, and I thought everything was going to go good. I thought I was going to be able to go to the research study, make a change for myself as well as others. I was willing to be that lab rat. I was willing to be that person to do it. But unexpectedly, she advised that, no, ma'am, you're at high risk for SUDEP. And that's where I was advised, and just getting knowledgeable on this topic here, which is very sensitive. It's a curse with epilepsy, but it's also a blessing. So I would just like to advise everyone who is going through this with yourself as well as family members, just be that support system for them. And if you're going through this yourself, don't give up. Again, my words, I do feel like this is a blessing as well as a curse. We're someone special here, and I know one day they will hear our voices. And again, sunflower syndrome, not too many doctors, providers, neurologists, epileptologists, they don't know about it. So it's Boston, Massachusetts Hospital. They are aware of sunflower syndrome, but I am on the list for SUDEP. And just hearing that, I got that news about 2 weeks ago when I was disqualified from the research study. And it's just dealing with disability. I lost my job in November 2024 behind epilepsy. There's a lot of discrimination out there with those jobs. And I support everything I'm sorry, guys. I'm so sorry. I support everything that's going on. I'm working with the Epilepsy Alliance program. I'm working with the Epilepsy Foundation program as well. And I just like to thank anyone is involving themselves around epilepsy. Thank you. Thank you for all that you guys do. Thank you. But again, my name is Micaiah. And if you guys can just send a prayer up for me. Again, it's a strain mentally and physically. I sleep constantly. My blood work is coming back abnormal. The doctors they're pretty close. They're keeping a close eye on me. But guys, just be honest. Please be honest with your doctors. Please be honest with your neurologists. Be honest with them. But thank you, guys. Thank you. I fully support this. Thank you.
Thank you.
Sorry.
Thank you, Micaiah, and please connect with Epilepsy Enlightenment on Facebook. I'm sorry for speaking over everyone, but I go through a lot of the same things you do, and please do.
Yes, sir. Yes, sir, Mr. Steven. I'm sorry, that's one more time, the group?
Epilepsy Enlightenment.
Epilepsy Enlightenment. Yes, sir. Thank you, Steven.
Thank you, Tia, for sharing your personal journey with epilepsy and shedding light on sunflower syndrome. And yes, we are blessed in Massachusetts. If you live here, we have great specialists that do a lot on sunflower syndrome. I'm glad, Tracy, that you were able to go to that event. And we will have to wrap up after Kayleen gives her says what she needs to say. And Lisa, if you don't mind sharing that last slide too, while Lisa is talking, so people can see those resources again before we close out the evening. Kaylin, is that how you say your name?
She's muted. Yeah. Her hand's up, but she's muted, unfortunately.
I asked her to unmute, but
Right, can you hear me now?
yes,
There she is.
and go ahead.
Sorry about that. Zoom was being a pain. Anyway, my name is Caitlin. I'm from Rhode Island. I'm 37. I was first diagnosed with epilepsy at the age of 11. Initially thought of as benign Rolandic epilepsy, which they thought would die out as a child. However, it did not. I went through a series of medications throughout the years, along with multiple neurologists. I did have a time point where, you know, I was seizure free, was able to drive, was able to be independent. And then my medication just stopped working correctly. And then it came to a point where I was having seizures be, you know, every 2 weeks to this moment. We'll just, sorry guys.
It's okay.
So anyway, one of the medications I was on, one of the neurologists just kept piling on medication, and one of which was lowering my sodium. However, he was not weaning me off. So finally I was just, you know, I need to change neurologists. And I'm so glad I did, because I have the best neurologist in the world, who suggested, because by the time I saw her, my seizures started clustering. Every 2 weeks, I would have maybe about 5 to 7 within a 3-day time period. And she suggested for me to have 2 in-hospital EEGs. The first one was standard, and I had 4. Normally you're discharged once you have 1. However, they kept me longer because they found out that my heart was also stopping in the middle of a seizure. So it was a battle between neurology and cardiology about giving me the pacemaker to piggyback off of Orlando. And my doctor fought for me because she thought that, you know, I essentially could pass away from SUDEP. I also was unaware of that at the time. I got the pacemaker. Things have been better, but I do have strange oddities even while on medication, such as you know, word finding problems, or I essentially zone out. They might be absent seizures now. I have no idea. Find that out soon. But I'm no longer blacking out like I used to. If anything, can be calculated as an essential seizure when things aren't right. But I'm fully conscious most of the time.
Thank you, Kaylin, for sharing your story. We appreciate that. I want to thank everyone, especially our guest speakers tonight, Lisa and Catherine and Kevin Hooper. Thank you, Bill, for coming in and sharing your expertise. Thank you to, I am always surprised when we get participants from all over the United States joining our webinars, and thank you so much for being here. I can't say enough about how empowering this evening was. And for those of you who shared your stories and were vulnerable with us, those of you who are advocating for yourselves and your families, and you've started podcasts and webinars and all these things, I'll definitely be checking them out. So again, thank you all tonight. I will send out this recording and any resources that came about in the chat. Lisa, that will be in the recording, but Lisa listed a bunch of great resources for people. So with that, thank you all very much, and I hope you have a great evening.
Good night.
Thank you. Good night.
Thank you.
Thank
Thanks,
you.
everybody.
Good night.
Night.